Welcome to our briefing on strong young people, strong communities. We're really thrilled and thank each of you for making the time to attend today. I would like to start by paying respect and honour to Aboriginal and Torres Strait Islander elders past, present and emerging. I want to acknowledge the stories, traditions and living cultures on this land and commit to building a brighter future together. The Strong Young People, Strong Communities program is committed to strengthening our young Aboriginal and Torres Strait Islander community members. My name is Mandy Hutchinson. I'm the CEO at Northern District Community Health. In Professor Patrick McGorry's report, Youth Mental Health, COVID and the New World Order, he recommends a locally operationalised young youth mental health model, connecting youth-facing agencies. However, in the Bolokelot and Gannawarra communities, there is little youth-facing agencies. Research indicates that 75% of mental health problems have their onset in young people aged 12 to 18, and that current health and other services are not adequate. It is the peak need for care and worst time for access, leading to loss of lives, futures, and mental wealth. Timing is everything. Across the Bolokelot and Gannawarra local government areas, and to a lesser extent Swan Hill Rural City Council, young people with mental ill health are not able to access the quality evidence-based services they need when they need them. This drives poor outcomes. This really requires a shift in how we currently support our young people. At Northern District Community Health, in partnership with the Bolokelot and Gannawarra LGAs and Swan Hill Rural City Council, we co-designed and are still delivering a mental health awareness program called Tactics for Tough Times. When the LGAs were allocated more funding for the next financial year through drought funding, we extended the life of this program. But after discussion, we agreed that young people were the priority. After reading McGorry's report and anecdotal stories of young people disengaging from education and engaging in more risk-taking behaviours. So we went and consulted, and whilst we could have pitched for a youth worker for 12 months, we decided that rather than fund a short-term crisis intervention that may impact on a few, we decided to be bolder and tackle the system. And the LGAs agreed with us, so we decided to strategically use the next 12 months to build a co-design model to support young people to be happy, healthy and ready for the challenges ahead. The North Central LEN has been running Strong Families, Strong Children in Loddon and now in Boloke. With the Grow, Gannawarra and Better Together Swan Hill models now emerging for the early years, we thought this was an opportunity to partner with the LEN and step into the next generation. So this is inherently a partnership between education, health and local government. And to be excited, to be honest, we are a lot excited about it. To tell you more today, we have two accomplished presenters, Jeanette Pope and Professor Craig Olsen. Jeanette Pope has worked in strategy, policy and research in government, statutory authorities, not-for-profits and universities. For a decade, she developed the strategy and research agenda for the Department for Victorian Communities, writing whole of government strategies and coordinating research and evaluation. Jeanette has been the wind beneath Strong Families, Strong Children and has again harnessed our thinking and will present on the concept for you today. Jeanette says, our governance institutions must change to become facilitators, advocates, users of big data and enablers of new business models. More importantly, they must become visionaries, bringing engagement with the community and its activities, together with the world's best science about change and evidence of what works. Leadership that joins the dots will build strong public policy and planning. And that's what we're trying to do here. To further help us join the dots, Professor Craig Olsen is going to talk to us about a comprehensive monitoring system for children and young people in Bolokelot and Gannawarra. Professor Olsen is a life course epidemiologist specialising in population-based longitudinal studies of child and adolescent development. He holds a National Health and Medical Research Council Fellowship, and prior to this was a recipient of an Australian Research Council Discovery Outstanding Researcher Award. He leads one of Australia's largest running Studies of Social and Emotional Development, the ATB Generation 3 study, which has followed over 2,000 young Australians from infancy to childhood to adolescence to young adulthood and into parenting the next generation since 1983. So I'm handing now over to Jeanette, and I hope you enjoy the morning. And Jane will finish off at the end to tell us what we can do together and how your critical partnership will help us achieve what we'd like to with this proposal. Thank you.
Put a testimonial that I'm the wind beneath anything on my website. That'll be great. So welcome everybody. I've been working with the partnership to develop a project charter for the Strong Young People, Strong Communities project. And I thought I'd just run through what we've gotten to so far. So we started off by writing a rationale for the project, so an investment logic, if you like, and which started with the data. So this has been triggered by data that shows that young people in our region are disengaging from school and lack optimism. We know from data pre-COVID that around a third of young people had low well-being on the optimism, self-esteem, happiness and absence of sadness scores. And they're also about a third are also leaving school early. And we know that if every year that you leave school early takes about 10% of your lifetime income off you. So very significant problems. But with COVID-19, we've really seen this escalate, and a child health poll from the Royal Children's Hospital showed around about half of young people were suffering from poor well-being and were lonely. And about a third of the households in which those young people live had lost enough income to impact on them paying for things like health services and also even for food. So it has gotten a lot worse. The Local Learning and Employment Network has also done a survey of all schools during COVID and found this huge impact on students' well-being, but also that young people are massively disengaging from school. So either just from learning or from school itself, but also a whole lot of other problems where young people have, say, reduced their VCE load, things like this that are going to impact on them actually having pathways. And anecdotal evidence from our ILM workshop suggests that all the partners suggested that there was also an increase in risk-taking behaviour. And we're seeing this kind of nihilistic culture develop, that has come with boredom and with inability for other things to do. We know that this costs communities enormously. A study in New South Wales that linked all of the service data together found that 1,000 vulnerable young people cost the state as much as the entirety of the under 25 population. So these costs of kind of disadvantage are huge. And we know that while our population is ageing and we are suffering these massive skill shortages at the moment, that we need every young person to be the absolutely best that they can be to get to the best job that they can get to. And I think the key point that the partnership made, in particular, Mandy made this point valiantly, is that this doesn't just impact on the young people and their careers and their pathways, but this impacts on the strength of our communities into the future. So if we don't do something about this now, we will lack community spirit and we will lack community leaders for a long time into the future. The research tells us that prevention works and it can impact on these negative outcomes and it can build community strength. But at the moment, we don't have a coordinated system that can provide it. And this was demonstrated when we were trying to write a little bit of advice for unemployed young people in the very early days of COVID. And we couldn't find any agency where we could send young people to, where they could get a holistic view of services to write into this document. So we don't have it out here. But what the research tells us is there's kind of three sets of services that young, and one is the services that wrap around families to make them healthy and well and make them strong places for young people to springboard off into their lives, but also that give them the financial and practical supports like internet access that give young people opportunities into the future. And I was delighted to see that dealt with in the last budget. The second set of services are when young people leave home and they go off to school. And those schools, those quality education services that then we know help them to aspire to their futures, and also then to set up their ability to become successful in their careers. And we know that out in rural areas that those services are older, their facilities tend to be more run down, and they have less access to curriculum. But again, the Len report, you know, a bit of hope there in that COVID has actually sorted out some of that access to different types of curriculum. And then the final set of services we kind of often forget, but these are what they used to call in social capital literature, the strength of weak ties, this connection out to the broader community that gives the mentors and services and the organisational support that provides young people with a whole lot of other resources in their lives to be successful. And it's those three things that this project needs to bring together into a model. The model for youth support that we are proposing is a partnership. What this partnership want to do is create a framework and a tool that for a place-based support system that can be sort of embedded in local governments or in other places, and that's flexible enough to be able to move around so that different areas can have different responses. But the model will outline a method and tools for creating a partnership between state government, local government, education, health organisations and other community organisations. It will employ a skilled broker, a facilitator, to do three things. So that broker will work with young people and their families to determine their needs, so that it'll be co-designed in that sense. The response will be co-designed by the families and young people. They'll build collaborations to help address those needs through system reform, so work out where the problems are and try and fix them in the system. And then work with community organisations to create new opportunities that might not exist at the moment. And finally, they will make sure that this model, the partnership will make sure that this model can be scaled to any area and is sustainable over time. So that's what they're proposing to work out, that model in the first year. And that sort of brings me to the nub of today, which is to talk a little bit about then the proposed governance of this partnership. So this project has a partnership group in place that is the Shires of Buloke, Loddon and Gannawarra and Swan Hill Rural City, the North Central Local Learning and Employment Network, and the North District Community Health are the governing partnership. And they have identified an experienced partnership broker in Jerry Nelson, who's here today, who will then undertake that work, that activity that I just talked about. So she will work out a way to find the young people and their families, to determine their needs, and to set up working groups with practitioners and others to work out how the system can be reformed. But what we need from you is the two other layers of governance that will be important. And one is we need a bunch of critical friends who are a network of critical friends who are leaders who can make sure that when these changes get proposed, that the authorising environment helps those things to actually become real. And then we need organisations to sort of go on a bench. And so what we will need is a whole lot of organisations to sit on our bench and then to put their hand up when a need gets identified that relates to them, to put their hand up to go on to a working group. And we'll make sure that that bench is mutually beneficial. So it will include briefings like this and forums, a bit of capacity building, things like that. But we're really hoping that you will find a place for yourself in our governance structure today. And I'll leave that there and hand over to Craig. But Jane at the end will plead with you in greater detail. But for now, over to you, Craig.
Thanks, Jeanette. I'm just going to share some slides here. Hopefully you can see that easily enough. As we were just mentioning, my background's in life course epidemiology. I've spent a career in following children and young people across those early developmental years in relation to their social and emotional wellbeing. I look over look after one of the longest running longitudinal studies of child development in Australia. It's known as the Australian Temperament Project. And this study's followed about 2,500 families over a long period of time now spanning 3 generations, and has an enormous wealth of information on all the things, Jeanette, that you were talking about that we need to invest in along the way. I wanted to also just point out that we sit in a region which has a very strong investment in longitudinal studies of social and emotional development. In Victoria alone, we have over 20 cohort studies with specialisations in these data areas. And in the broader Australian, New Zealand region, we have some of the finest longitudinal studies of child social and emotional development in the world, 55 in total actually. So we have an enormous wealth of knowledge about what it means to grow young people well across that life course. This is just a bit of an example of what comes out of these studies. This is a massive model done on a New Zealand study. It was looking at the 2 different sort of developmental pathways, the one down the bottom through education, and the one at the top through social and emotional development, supporting those processes, and long-term outcomes at 32 years of age. So that's the period around the time people become parents, and it's sort of a critical period in terms of setting the foundations of the next generation. So this was a very important piece of work that was done, and it sort of demonstrated that, by the time a child is in grade 6, you really have got a lot of the structure of how they're going to achieve academically at year 12. The correlation's about 0.9, it's striking. When you look at that social developmental pathway from grade 6 through to year 12, there's a lot more movement, there's a lot more opportunity to get in, a lot more possibility to do things. When you trace it out to 32 years of age, that academic pathway is very loosely, very lightly correlated with how they have formed themselves as human beings and future parents. But when you look at that investment in the social emotional pathway, the correlation there, 0.6, is a very strong legacy that's left by the end of the teens into that young adult life and that intergenerational cycle and how it completes itself from a mental health perspective. So what all these cohorts have told us time and time again, repeated over and over worldwide, is that every age and stage of development matters when you're supporting children and young people. You can't drop the ball at any one stage. That if you're going to do this properly, you have to start from birth, and you have to create a structure that monitors and charts the development of young people across all that time. Now, in terms of that monitoring, so bringing the data from these cohort studies to life in communities, we have at the moment at best a patchwork quilt. So this is an image here of all the different monitoring systems that would help us get big data on populations for looking at social emotional development, how to support it locally, nationally and internationally. And we don't have yet this comprehensive developmentally integrated picture. We do have a brilliant starting point, the Australian Early Development Census. It's probably one of the best examples of population monitoring and big data capture of this kind anywhere in the world. I'd say 96% response rate, whole of population capture on school entry. And so what we wanted to show you today was a project we've just recently had funded by the National Health and Medical Research Council that is effectively an extension of the AEDC that brings all that wealth of knowledge from the longitudinal studies to inform a population level comprehensive monitoring system across the early life course, and giving information on mental health problems and competencies and the social context that structure those things. So the data we need to make decisions, basically. So the first part of this system is a set of developmentally sequenced and linked indicators, a set of census surveys, if you like, that anchor around the Australian Early Development Census and can be used to get whole population capture of early development. The census itself is built around a model which recognises 4 core foundations to emotional health: our physical health, our co-regulation or our relational health, our internal coping and self-regulation capabilities, but ends up in an important 4th domain, which is the movement towards a global citizen that has an engagement in the world, the kind of young people that we need to grow to be leaders of the future. Now, what we've done in addition to that is to say it's not just enough to monitor the population. We need to be able to provide some responses, some evidence-based responses from the scientific community about what can be done in terms of interventions. So we've recently almost completed a new portal which brings together all the interventions evaluated in randomised controlled trials, so high-level evidence interventions that match to each age and stage of that life journey and that map to the indicators in the census system. So this is simply a portal that people can log into. You can type a term in the green box there, and it'll pop up with all the interventions that we know about that have known efficacy. This whole system, though, has to be owned by the community. It's really to be run by community. It's for communities, and so we have this middle bit of the whole system, which is the full integration of the census system and the response to the survey results that involve the various departments of government and the various levels of community to make it work. It doesn't work if it's not community-led, and that's a key feature. It's a community-based participatory research exercise. The first full trial of this system is happening in your region. It's a fantastic opportunity. We've really enjoyed the engagement with everybody in this space. We have been delayed by COVID. We have, though, plans for next year to implement the system from birth right through. We did get an opportunity, and we're almost finished on this one with the young adult census. It was able to proceed this year. And this just gives, we're at 62% of the, we do want an 80% response rate, if not 90. And this, I won't go into detail, I don't have time, but this is how we can begin to plate out some of the information that's coming from those surveys in terms of that developmental model that underpins the system. Ideally, we would expand this system statewide, and we would have the ability to capture the development, social and emotional development of children and young people across the state. So this is a leadership opportunity in the Northwest that I really appreciate being involved with. I'll leave it at that. Thanks, Manny.
Thank you so much, Craig and Jeanette. It's amazing what ground you can cover in 20 minutes. I feel like we put you both under pressure, but you did cover a lot of ground there, and I feel like Mandy and I are just riding on your coattails. Now my role, as Jeanette said, is really to plead with you to get involved, and I'm actually good at pleading, so that's great. So I guess I'm hoping and I'm sure that you can see the synergies and the alignment between the two initiatives that we've just outlined to you now, or Jeanette and Craig have just outlined. So I'm sure you can also see that these are based on tried and tested evidence-informed models. So in the case of the comprehensive monitoring system, it's based on an extension of the AEDC in both directions, earlier and later. And in terms of the strong young people, strong community, that's based on an extension of the work that we've been doing and the learnings we have from our strong families, strong children work. So we're continuing this evidence-informed, and to use borrow Jeanette's words again, we're trying to develop an ecosystem of place-based responses to best support our children and young people. And we really need all of you to get involved. This is work for everyone. And we will, as Jeanette said, we will definitely ensure that this is all mutually beneficial. But in the end, we really aiming for best outcomes for our children and young people. So in order to break the intergenerational cycle of entrenched disadvantage, as Craig's been discussing there, we need to use the best evidence-informed approaches and make sure, I love this phrase, that we don't drop the ball at any stage. And the comprehensive monitoring system takes that explicitly life course approach to monitoring and supporting growth in core capabilities needed for building the long-term social and economic capital of our Loddon, Bullock and Gannawarra people. So, and we've already started testing that with the young adult census, but with the population-based surveillance, we really do need everyone to get involved, because as Craig said, we really need high involvement, high participation, and next year we're going to roll out from the start of the year alongside the AEDC all of these surveys, and particularly those of you who are involved in school settings. It would be wonderful to have your authorisation and also your encouragement around this work to get schools involved. We have had, in the little bits of involvement we've had with schools already, we've had a very positive response, and we intend to go out and provide more information to them. Obviously, we've been very sensitive to the timing, and that's why we've rolled it into next year. But we're really hoping that people will see that this is, absolutely critical, even in terms of our response to COVID-19 as well. We actually need to continue this work. We need to continue this work to get best outcomes for our children and young people. So yes, we will actually have media and social media, and we'll have lots of information out there, but the key contexts are the schools and the shires with the maternal and child health. So we really do need your help around that, and I would plead that you would get involved with that. And then just to extend on what Jeanette was talking about, and she did a really beautiful job of telling us about the very early stages of the work we've been doing around exploring this strong young people, strong community model. Again, we have sort of initiated and begun exploring this with a partnership with basically community health, local government and the LEN. But we would love for you to get involved, because obviously the partnership needs to be much bigger than that. As Jeanette outlined, many of you hopefully will recognise that you are the critical friends and mentioned in the governance model. You're the local or regional decision makers who create support for the systems change required. We especially need your help to bring schools and other critical groups of practitioners to the table. And yeah, we again, we'll hope this is mutually beneficial work, and we will demonstrate that along the way. I guess the other side of it is many of you might reflect and decide that you are the bench that Jeanette talked about. We love this sporting language. It actually means a lot to us. And we'll again commit to supporting and interested organisations, and we'll keep you informed through, as Jeanette said, forums, etc., and other communication, because we really want to share this work with you as well. We want you to be able to come off the bench and take part in the working groups, etc., as required. Now, the other really key part of this model that Jeanette outlined was that we do need a skilled facilitator. There's so much goodwill around the fantastic partnerships we have in Northwest Victoria, but I'm sure all of you will back up the thought that you need to have a facilitator, particularly in rural areas, because there's such goodwill, but we just need those legs on the ground sometimes to connect up the work. So we're very fortunate, as Jeanette said, to have Jerry Nelson, who is going to second into this role, and we thank her for taking on the challenge, and we know that everyone is going to support her around that as well. So just in closing, on behalf of this passionate new partnership, I really thank you for your interest and your attendance at this briefing today, and it really was a briefing. We really want you to get involved in the conversation moving forward, because no one or two organisations or even one or two sectors can change the trajectory of our children and young people on their own. We need every one of us to commit to our roles in this collaboration and partnership. So we will be in touch, but please don't hesitate to contact us at any time with any questions, contributions, feedback. We'd love to make sure we align with the work that you're involved with. So please, let us know, because we want to take the next steps together in this, in developing this strong young people, strong community. And I guess I'd just really like to finish with the quote that Mandy sort of began with of Jeanette's, that leadership that joins the dots will lead to great policies and programs in our communities. So thank you for coming aboard.